Okay, I'm going to be doing wound care, suture removal, and staple remover today. I kind of went ahead and set up some of my stuff. I have, of course, you open this, especially with sterile, onto a sterile field, which I have here. And then you would drop each piece into a sterile field, throw the package away. But since this is not sterile, I went ahead and opened everything onto a sheet so it's not getting dirty. So I have everything opened up and set out. And these are my gloves I'm going to continue to reuse. And I have my trash bag, my cup trash bag taped to the table. And this is me, my wound, my staples, and my sutures. So first, we're going to do wound care. I'll go ahead and ask the patient her name and date of birth, any pain or swelling, check around the dressing for any redness or swelling there before I even start the wound care or remove the old dressing. Let me go ahead and put one of these on here so I can act like it's a dressing. So before I remove this dressing, that's when I would ask the name, date of birth, look around the dressing, check my orders, make sure I'm supposed to be removing it, verify everything, go over the procedure with the patient, make sure they're not in too much pain, give them pain medication if the wound care does bother them, so they'll be won't be experiencing too much pain during the wound care. And then I'll wash my hands and put on gloves, and this is supposed to be a clean wound care, so they're not sterile. And then I would have already moved the tape off the skin, but I'm not going to do it because it's paper. But then I would go ahead and take this dressing off. I'm going to look at the drainage on here. I'm not going to show the patient to make sure that I do not scather them anything. So I'll go ahead and throw this away. And then I would go ahead and measure with my measuring tool. While I'm looking at this wound, I need to be looking for any kind of prolate drainage, abnormalities, redness, swelling, anything indicating infection or any kind of problems. So I'll measure from width to width. Side to side for width. And then I would measure top to bottom for height. And then for depth, I would take a Q-tip, go to the deepest part of the wound, of course measure, kind of mark it with your fingernail. Say the wound was this depth, I would measure that depth on the ruler. And then of course I would throw away the ruler. Then I would take off my gloves, wash my hands, put on new gloves, go ahead and clean. So when I clean, I'm going to act like this is my fake normal saline. You can damp it with here, or sometimes they have the saline bullets where you can drain onto the wound, just kind of rinse it off first. But usually you'll soak a gauze pad with regular saline. And you want to clean from dirtiest to clean in circular motion. So you'll go out and never touch the wound, never touch the gauze to the same spot twice. So always move around or wipe, throw away. And then you continue to clean with damping saline into circular motions away from the clean. And it's wipe, throw away. Which I'm going to save this so I can have an extra one. So now that we've cleaned the wound, we're going to take off our gloves, which I'll show you at the end how to take off the gloves properly because I don't have any more gloves to use. But you're going to take off the gloves, clean your hands, apply new gloves, and at this point is when you would apply any kind of ointments or anything that needs to be applied to the wound bed, any kind of edge wound cream or cream around the wound for preparation, all that good stuff. Then you would go ahead and apply gauze pads, and this is going to be a specific order, so make sure that you apply them flat. Make sure they're good. These could be wet to dry, but these are just a dry dressing for a regular dressing change we're doing. Make sure that your dressing with name, date, and time is on here, and you're going to put it over the top. And then of course you'll have your tape, which I didn't go ahead and take my tape off, but usually go ahead and have your tape ready. But I like to measure my lengths, but you'll make sure get the skin and the dressing down. make sure you're covering the edges of the whole dressing so no infection gets out to healthy skin and no infection gets in, anything new gets into the open wound. And yes, I did not do my tape right because I was supposed to take it off before, but I did realize that as I started going, it's really hard with trying to get all my supplies together, trying to piece them out. Of our kit. Okay, so now I have the wound all the way taped down. I'm going to make sure and ask the patient if they're feeling any uncomfortableness. I'm going to make sure this tape is flat so it's not pulling on the skin. Make sure they're not getting a reaction to the skin, the tape. Make sure it's staying. And then you, of course, would go ahead and take your gloves off, pinch here, pull off, ball up, and then inside the cuff. I'm sorry, I thought you could see. Pull out. So you're having the clean side of the glove, and then throw away. I'm going to go ahead and throw these away for the staple and suture removers. Let me get this out of the way. Okay, so first we're going to do sutures. Here's my fake sutures. You are supposed to have gloved hands. I washed them and gloved them. I just don't have any more gloves. But first, you want to, of course, ask the patient the name, date of birth. Make sure your orders are verified. You're supposed to be removing the sutures. Pull any dressings off of this that may be there, and look at the site. Make sure there's no drainage or redness and signs of infection. When you start the staple remover, you want to pull, you want to do the second suture, every other suture. So we're going to start at the second one, and we're going to grab the knot, and you only want to pull straight up. You don't really want to pull tension anywhere but straight, just enough to get underneath that knot to cut. So we're going to cut here, because when you cut here, it prevents the suture that is on the outside from contaminating the inside. So you're just going to cut there and pull straight out to the right. And I am supposed to have this already over here. But you'll have a gauze pad or some kind of bucket or anything sterile that you can check out your suture and put onto the gauze pad to make sure that you're counting the sutures. Then you'll go here, pull the knot up, cut here, right under the knot, pull out to the right, check out your suture, make sure there's nothing missing, it's intact, lay it on your counting piece. And here, which I forgot to do this at first, I just realized, but before I did sutures, I should have cleaned around the suture site first. But now that I've took out these two sutures, I'm going to clean at this site where I took the sutures out. And you want to try to use different sides of the Q-tip, which I only have this one Q-tip, so we're going to continue to use it. I'm going to act like it's brand new. And then you'll remove these staples. And while you're doing this, you want to make sure that the incision is not opening. If you do see any incision that is open, you will notify the physician. Stop and notify the physician. But before I take those staples out, sorry, I keep confusing myself. I'm having a horrible day with these videos. You want to put Steri-strips, which I have fake Steri-strips that I'm using. But when you lay the Steri-strips down, you want to go from one side and lay it down flat, making sure it's not pulling the skin to the other. And they should be 1/8 inch apart, 3/4 inch on each side. Make sure you go one side to the other. And this is to prevent the wound from opening while you're removing the staples. So then you will go here, pull up on the knot, cut under the knot, and then pull to the right to make sure the suture comes all the way out. Check out your suture, put it in your gauze pad, and then you will do your last suture, pull it up, cut under the knot right above the skin, which I'm having trouble because I'm using paper and real scissors and tweezers. And then pull to the right to make sure nothing goes through the skin that hasn't been exposed to the skin. Check out your suture and lay it in your thing so you can count them. And so here I have 4. Then of course you'll clean again on these sites that are open using all different sides of the Q-tip. And then you will put your steri strips. Making sure you're going from one side to the other, laying flatly so no skin is pulling. So now you should have steri strips, and you want to make sure that this incision doesn't need to be covered by any other extra dressings, or maybe it could rub the steri strips, rub the incision, make it break back open. But that is it for the sutures. Now I'm going to move on to the staples. Let me throw away my sutures, but I'm going to reuse this gauze pad. Oh, I'll use this one. Okay, so here's my gauze pads for us to throw my staples at. Of course, this is also a clean, sterile. These usually come in kits. I had one from my old kit, but you'll of course want to make your field. Open up your stuff, drop it in with not bringing sterile field. But I don't have any more gloves or anything, so we're just kind of going with what I got. Anyways, okay, so what we're going to do is the same thing with the sutures. Make sure verify orders, look at the incision, make sure there's no drainage or infection. And then when we go to start the staples, you also make sure they're not having any pain. Make sure you don't need to give them any kind of pain medication before the procedure. So I will use the cupped in of the suture scissors to go under the second staple with every other staple, just like the sutures. Wait, before I do it again, I'm going to clean first around the in-suture site using different areas of the Q-tip. Then remove the second suture. And I'm not going to move it or anything, I'm just going to squeeze this and it'll bring the staple out itself, but you can't tell because it's paper, it came with it. But you will check out your staple, make sure there's no pieces missing, and drop it in the gauze for you to count. And then you'll go to this one, do the same thing, which I have paper, it's not liking to come out. Check out your staple, put it into the gauze to count. And here you will stop, clean with a new Q-tip, clean the areas that you just removed from all different spots. Apply steri strips. Well, if I can get my steri strip. There. And make sure you're going from side to side to make sure there's no pulling of the skin. They need to be 1/8 inch apart. Of course, mine are a little bit longer. Then you'll go to the next staples to remove them. Put the cupped in underneath them. Push down the lever. Check out your staple. Put on your gauze pad to count. and then go to the next one. And you also want to be watching for any openings on this incision the whole time. Check your staple, put it on the gauze pad to count, clean these areas, and apply stair strips. Make sure you're going from one side to the other to prevent skin pulling. And count your staples. Make sure that's how many was in the skin. Wash your hands, remove gloves, wash your hands, and document. And you would document how many staples you removed, how the patient tolerated it, any pain medication given, and what the incision looks like. Thank you.